Hi everyone. There's a few groups that I'm part of that have to do with orthopedic conditions and discussion around joints and things like this. One of the posts in it asked thoughts about, would you consider postponing surgery in favor of doing something else? And that something else may be life driven or focusing on pain control and waiting until another time to have an operation. And I responded to this post and I wanted to share a video about it as well, because I think there's some purpose in addressing this. So first off, I understand that surgery is incredibly personal, and you really can't take for granted that an operation's going to work out well. I find myself aiming for the best, but preparing if something goes wrong or the recovery doesn't go as planned, that at least the bottom of my life hasn't fallen out from underneath me. And I've certainly had this happen to me a few times now. I should say that for someone's having surgery and watching this video, I'm not out to scare you in saying this. A lot of what's gone wrong has been themed around stuff that happened in the 1970s to my body that causes surgery not to play out in the typical fashion. So I don't want to worry you. So you end up with the very real thoughts over, do I do it now or do I wait until later, with a very specific purpose or set of goals that I'll be completing now. The first thing that I would highly suggest that you consider is the willingness of your surgeon to wait and work with you on the timing of your operation. Now, the surgeons I've had have always said to me that they'd work with me, and like when I wanted to wait a few months to finish the solar panel installation on my property, the surgeon was understanding and happy to accommodate this. This wasn't a case of, well, here's one reason and another excuse, and by the time you get to the third or fourth excuse, you're really questioning if this could be achieved or not. There are sometimes other things that aren't directly under your control, like if the significant other in your life is having health problems, it'd be better to wait while their health care works out so that they can be part of your team. Now you can get around this, and what I mean is if they are not really in a position to help, maybe there's other people in the community, neighbors, connections at church, even through your workplace, that may be able to come rally around you. And if you cook a few weeks worth of meals up ahead of time and freeze them, certainly the worst of an operation can be got through, and then you're back on with life again, and sort of the 6-week crisis will pass that an operation creates. There is practical consideration to be given to taking care of pets, and that you would not be having a surgery because there wasn't a plan in place for your pets to be had. If you're offered an operation, overall, I would tend to think that it's because the doctor has a compelling reason that something needs to change, and that there is just cause for that something to change for the better. So if you're not going to be having an operation immediately, then I think you need to think through what it is you're going to be doing instead of having that operation, and then what are the steps that you're going to be taking so that you'll get to the point where the operation's going to happen. The flip side of this is also to talk to some people in your life that really know you well and have the discussion if they honestly think that the reasons why you're waiting are compelling enough to justify waiting. If it is fear that's causing you not to pursue an operation, quite honestly, there's a number of things that you could do that would help you address the fear of the unknown. Part of it would be connecting with a group of people that have undergone a similar operation so you know what to expect, and so you have a chance to connect with others who are sort of traveling the same road in life. So for orthopedic surgery, that's sort of the part of the medical world that I'm a part of. For orthopedic surgery, the surgeon's office may very well know of reputable groups that you could talk to, or patient advocates that would help get you through a time in life where you know what to expect, you know what to plan for, you know, that sort of the unknown from the equation gets taken out of it. There is a great deal of stress that your body goes through when you have an operation. And one of the things that I think about is making sure that you have sufficient emotional support to get you through that time in your life. So being able to either have a few trusted friends, either in person or on the computer, or you risk opening up a little bit about yourself to a colleague at work or church or a social club, would all be viable options. If you are really, really struggling and you don't feel that there's someone in your life that you could open up to, my suggestion would be to reach out to your local hospital and ask if you could speak to the sort of the pastoral care, the sort of spiritual group that the hospital will have. And like I know from the local hospital, there's a number of faiths that are represented, and you might be able to have a meeting or two with that individual before you're admitted into the hospital, and then they could come visit you while you're in the hospital to help be there for you and sort of over the initial hump of support. Now, if it's crippling mental illness, that's the real issue. There are inpatient services available where the hospital will set you up with the appropriate mental health support while you're their patient, and to help follow you through the recovery process. And if this is what you're needing, there's really no shame in it. We all come from a different road in life. Some are harder roads to take, and having that extra support may be the shot in the arm that you need to get through sort of whatever's gone on over here in your life. And certainly you could talk about this during your pre-hospital screening time. That's the series of meetings that you have when you're getting ready for an appointment where the hospital's interviewing you as much as you're interviewing them to figure out the logistics of what you need while you're a patient in the hospital. And this is something that I would encourage you to pursue if you're needing it. And on a very personal note, this was offered to me, and what was asked of me was to explain how I'm managing day-to-day life to assess if I needed it or not. And I legitimately didn't need it, but they wanted to make sure that I was doing okay and could manage a few days in hospital and the stress that you undergo with an operation to be okay and coping with life. So I can appreciate for those who do need it, it's done respectfully, although you need to have a level of trust with the person you haven't met before to express this is what's going on in your life, but the hospital does genuinely want to help. Sort of my final thought about this is to take some time to think, and even if you're offered an operation, saying to the surgeon that you need a few days to think it through and how you'll manage logistics is a perfectly reasonable response to this. Or asking if you could have a follow-up appointment in, say, 6 weeks where you can talk about any questions you have so that you're prepared for it and setting yourself up for success. If you're set for an appointment, generally you would know that you're going there for a specific purpose. But the odd time, you'll go for routine screening, whether it's a mammogram or what you think may be belly pain or whatever, and all of a sudden cancer's right in front of you. And even in those situations, there is still lots of support. The hospitals do a really good job of being reactive to a situation. So it may be new to you, but it's not to the hospital and the resources they can bring to bear on a given situation to help you at that time in your life. And so even if a diagnosis shocks you for a few days, talking about it, making an appointment with your family doctor where you talk for maybe 10 or 15 minutes, and it helps alleviate some of the concerns so then you can face the new information that's been brought to light, may be one route to go. And the other thing that I would say, or the final thing that I would say, is generally to trust the process, and if something's not feeling quite right to you, then to begin asking questions and seeing what else is there. When you're backed into a corner, the hospital patient experience or patient relations group is there to be your advocate and sort of be an intermediary with a given doctor or a given situation. And so you're not alone at that time, and there may be a lot of unknown, but that you're not sort of left out to wanderously aim and be unsure about life. Anyway, that's the answer. It's a little bit longer than I wanted to go in, but it's a deeper topic that there's a lot to it. Thanks for this time that you spent with me today. Bye for now.